The medical ship Hope's Dawn floated dead in the black void of space like a broken toy. Its hull was torn and twisted from the battle that had just ended. Emergency lights flickered weakly through the damaged corridors. The air recycling systems made strange grinding noises that echoed through the empty hallways. Captain Jake Morrison lay still on the medical table. His chest did not rise or fall. The monitoring equipment around him showed flat lines across every screen. No heartbeat? No brain activity. No signs of life at all. The battle had been fierce, and when the enemy plasma cannon hit the bridge, Jake had taken the full blast trying to save his crew. Nurse Amy Carter stood beside the table with her hands pressed firmly on Jake's chest. She pushed down hard and then released. Push and release. Push and release. She had been doing this for 6 minutes now. Sweat dripped from her forehead, but she did not stop. Her arms ached, but she kept going. The alien medical staff watched her with sad expressions. Dr. Kethvar was a tall reptilian being with green scales and yellow eyes. He had been the chief medical officer on many ships before this one. His people were known throughout the galaxy for their medical knowledge. He shook his large head slowly. "Human Amy, you must stop now," Dr. Kethvar said in his deep voice. "Captain Morrison has been dead for too long. His brain cannot survive without oxygen for more than 3 minutes. This is medical fact known by all species in the galaxy." Amy did not look up from her work. She continued the chest compressions while checking Jake's pulse. Still nothing. "I'm not giving up on him," she said between breaths. "Not yet." Zixta, the insectoid engineer, clicked her mandibles together in the way her people showed confusion. Her 6 arms moved nervously as she spoke. "But Amy Human, the captain's body shows no life signs. Even my people who are very hard to kill cannot survive this long without a heartbeat. Why do you continue this useless task?" "Because he's not dead until I say he's dead," Amy replied. She tilted Jake's head back and breathed into his lungs twice. Then she went back to the chest compressions. "In human medicine, we have a saying, 'You're not dead until you're warm and dead.'" The other aliens in the medical bay looked at each other with puzzled expressions. There were several Vorthan medics with their blue skin and large black eyes, a few Kalari nurses with their fur-covered faces and long tails, even some Thakarian doctors with their crystal-like skin that changed colors with their emotions. All of them had given up hope when Jake's heart stopped beating. Dr. Kethvar approached Amy carefully. "Human friend, I understand your feelings for your captain, but we must face reality. No being in the known galaxy can survive brain death. The longest any species has ever been brought back from cardiac arrest is 4 minutes for the Zephyrians. Even they have special organs that help them survive longer without oxygen." Amy paused her compressions for a moment to wipe the sweat from her eyes. "How long have I been doing this?" she asked. 7 minutes and 34 seconds, replied Zixta, who had been timing everything with her internal chronometer. The aliens gasped. 7 minutes was far beyond what any of them thought possible. Even the hardy Kalari people who could survive in harsh environments only lasted 5 minutes without a heartbeat before permanent brain damage occurred. "You see," Dr. Kethvar said gently, "it is too late. The captain's brain has been without oxygen for too long. Even if his heart were to start beating again, his mind would be gone." Amy shook her head and resumed the compressions. "You don't know humans very well, do you?" She looked around at all the alien faces staring at her. "We're stubborn. We don't give up easy. And our bodies are tougher than you." Think, she had trained for this back on Earth. The Human Medical Academy had taught her about cases where people had been brought back after 15 minutes or even longer. Cold water drowning victims. People who had heart attacks in the snow. Humans who had been declared dead by other species but still recovered. "Dr. Kethvar," Amy said while continuing her work. "What's the temperature in this room right now?" The reptilian doctor checked his instruments. 15 degrees Celsius. The heating systems were damaged in the battle. "Good," Amy said. "That's helping us. The cold slows down brain death in humans. It gives us more time." She reached for her medical kit and pulled out a syringe filled with clear liquid. "This is epinephrine. It's a human drug that can restart hearts." She injected it directly into Jake's chest near his heart. The aliens watched in fascination as Amy continued working. They had never seen medical techniques like these before. In their cultures, when someone's heart stopped beating, they performed brief rituals and then accepted death as natural. But this human female refused to accept what seemed impossible to overcome. Amy checked Jake's pulse again. Still nothing. But she did not stop. She went back to the chest compressions while explaining what she was doing. I'm manually pumping his heart, forcing blood to flow through his body and brain. The epinephrine should help stimulate his heart muscle. 8 minutes had passed now. Then 9 minutes. The aliens began to whisper among themselves in their various languages. They had never seen anything like this before. A being working so hard to bring back someone who was clearly dead by all known medical standards. Dr. Kethavar found himself drawn closer to watch Amy's technique. The way she positioned her hands, the rhythm of her compressions, the angle at which she tilted Jake's head to keep his airway open. These were methods his people had never developed because they had never needed them. Human Amy, he said quietly. If by some miracle Captain Morrison does return to life, what condition will his brain be in? Surely there must be damage by now. Amy looked up at him briefly. Her eyes were determined and fierce. Maybe, but maybe not. Humans have survived longer than this before. Our brains are built different than yours. We evolved on a dangerous world. Our bodies had to learn how to survive things that would kill other species. 10 minutes had passed. The aliens were no longer whispering. They watched in complete silence as Amy continued her desperate efforts. Some of them began to feel something they had never experienced before when dealing with death. Hope. This strange human emotion that refused to accept defeat even when facing impossible odds. Amy prepared another injection. This time it was a different drug. This is called atropine, she explained. It helps with certain types of heart problems. She injected it into Jake's arm while never stopping the chest compressions with her other hand. The monitoring equipment continued to show flat lines. But Amy did not look at the screens. She focused entirely on Jake's face and on the work her hands were doing. Push and release, breathe into his lungs, check for pulse, start again. 11 minutes had gone by when something changed. Amy felt something different under her hands. It was tiny, but it was there. Jake's chest felt less stiff than before. She pressed her fingers against his neck, searching for any sign of a pulse. The aliens around her leaned in closer, trying to see what she was doing. Is there something? Dr. Kethavar asked. His yellow eyes were wide with curiosity. Maybe, Amy said. She did not want to get anyone's hopes up, including her own. I think his body temperature is starting to rise a little bit. That could be a good sign. She continued the chest compressions while talking to the alien medical staff. In human medicine, we learn that the brain can survive much longer than other species think. Especially when the body gets cold like Jake's did when the ship's heating failed. Sixta clicked her mandibles together. But Amy, human, how is this possible? My people are engineers, and we understand biology as a form of engineering. When the central pump stops working, the entire system fails within minutes. Amy smiled slightly while keeping up her rhythm. Your people think of bodies like machines. But human bodies are more like living computers. We have backup systems, ways to keep going when the main systems fail. She paused to give Jake 2 more breaths. For example, did you know that human children have been brought back to life after being underwater in cold water for over an hour? Their bodies shut down to save energy. They go into a kind of hibernation. The Vorthan medics looked at each other with their large black eyes. One of them spoke up in his musical voice. This is not possible according to our medical knowledge. Brain cells die without oxygen. This is universal law of biology. Not for humans, Amy said. Our brain cells can survive longer because of something called anaerobic metabolism. We can use different chemicals to keep our cells alive when there's no oxygen. Dr. Kethavar was taking notes on his medical tablet. Please explain this anaerobic metabolism. This is not something we have encountered in any other species. Amy continued working while she talked. When human cells can't get oxygen, they switch to using other things for energy. Like sugar. It's not as good as using oxygen, but it keeps the cells alive longer. Some humans have survived being frozen in ice for hours. 12 minutes had passed since Jake's heart had stopped. Amy reached into her medical kit again and pulled out a different device. It looked like 2 metal paddles connected to a small machine by thick cables. What is that device? Asked one of the Kalari nurses. Her furry face was full of curiosity. It's called a defibrillator, Amy explained. It sends electricity through the heart to try to make it start beating again. She placed the paddles on Jake's chest in specific positions. Everyone needs to step back. This is going to give him a big electric shock. The aliens moved away from the table. They had never seen anything like this before. Using electricity to try to restart a heart seemed dangerous and strange to them. Amy charged up the machine. It made a high-pitched whining sound as it built up power. "Clear!" she shouted and then pressed both paddles down on Jake's chest. Jake's body jumped up from the table as the electricity went through him. Every muscle in his body tensed for a moment and then relaxed again. Amy quickly checked the monitors. "Still flatlines, nothing yet," she said. "But that's okay. Sometimes it takes more than one try." She charged up the defibrillator again. Dr. Kethvar watched closely. "This electric shock therapy is completely unknown to us. How did humans discover this treatment?" "By accident at first," Amy said while preparing for another shock. "A human doctor many years ago noticed that people who got struck by lightning sometimes had their hearts restart. So we learned how to control electricity to help instead of hurt." She gave Jake another shock. His body jumped again, but the monitor still showed no change. Amy was not discouraged. She had seen cases back on Earth where it took many attempts before the heart started working again. 13 minutes had passed. Then 14. The alien medical staff began to whisper among themselves again. Even by human standards, this was taking a very long time. But Amy did not stop. She went back to chest compressions while talking about human physiology. "Our hearts are different from most species, too. We have what's called a sinoatrial node. It's like a natural pacemaker. Sometimes when a heart stops, this node keeps trying to work even when everything else has failed." Sixta was fascinated. "So the human heart has its own backup system? This explains why you do not give up as quickly as other species." "Exactly," Amy said. "Plus human hearts are very muscular. They can sometimes restart themselves if you give them enough help." She prepared the defibrillator for a third attempt. This time, when she shocked Jake, something different happened. One of the monitors showed a small blip. It was tiny, but it was definitely there. "Did you see that?" Amy asked excitedly. "There was some electrical activity in his heart." Dr. Kethvar stared at his instruments in amazement. "Yes, I saw it. But it was only for a moment." "How can you be sure this means anything?" Amy was already preparing another dose of medication. "Because it means his heart is trying to work. The electrical system is still there. It just needs more help." She injected the new drug directly into Jake's heart muscle. The aliens watched as Amy continued working with renewed energy. She had been doing chest compressions for 15 minutes now, but she showed no signs of getting tired. Her determination was something they had never seen before. "Human Amy," said one of the Vorthon medics, "why do your people fight so hard against death? In our culture, we accept death as a natural part of life. When someone's time comes, we let them go peacefully." Amy looked up at him while continuing her compressions. "Because every life is precious. Because maybe his family is waiting for him to come home. Because he still has things to do and people to help." She paused to check Jake's pulse again, "and because I promised him I would never give up on him." The room fell silent except for the sound of Amy's hands pushing on Jake's chest and the quiet hum of the medical equipment. 16 minutes had passed since his heart had stopped beating. Dr. Kethvar found himself thinking about his own medical training. His people were taught that death was final and should be accepted with dignity. But watching this human female refuse to accept defeat made him wonder if they had been wrong about some things. Amy prepared the defibrillator again. "One more time," she said. "Sometimes the heart needs to be reminded how to beat properly." She placed the paddles on Jake's chest and charged up the machine. "Clear," she shouted and delivered another shock. This time the monitor showed more than just a blip. There was a small spike followed by another one. And then another. "There," Amy pointed at the screen. "His heart is trying to find its rhythm again." The small spikes on the monitor were irregular and weak, but they were definitely there. Amy felt Jake's neck again, searching for a pulse. Still nothing she could feel with her fingers, but the electronic sensors were picking up tiny electrical signals from his heart. "This is remarkable," Dr. Kethvar said, as he studied the readings. "In all my years of medicine, I have never seen brain activity return after this much time." "How is this possible?" Amy continued the chest compressions while explaining. "Human brains work differently than other species. We have something called the mammalian diving reflex. When humans get very cold or underwater, our bodies automatically slow down to save energy." She gestured toward Jake's body with her free hand. "Look at his skin. See how pale and cold it is? That's actually helping him right now. The cold temperature is slowing down his brain's need for oxygen." Sixta was recording everything on her tablet. "Please explain this diving reflex. My engineering knowledge does not include such biological mechanisms." When humans are in danger of drowning or freezing, our blood flow changes, Amy said. The body sends most of the blood to the brain and heart. Less important parts like arms and legs get less blood. This helps keep the vital organs alive longer. One of the Kalari nurses touched Jake's arm with her furry hand. His skin is very cold. But you say this is helping him? Yes, Amy replied. For every 10 degrees that body temperature drops, the brain's need for oxygen goes down by about half. Jake's temperature dropped a lot when the ship's heating failed. That gave him extra time. Dr. Kethvar was amazed. So humans evolved these survival mechanisms because your homeworld was dangerous? Amy nodded while continuing her work. Earth has lots of cold water and harsh weather. Humans who could survive drowning or freezing were more likely to have children. Over many generations, we developed these abilities. She prepared another injection. This is called calcium chloride. It helps heart muscle cells work better. She injected it into Jake's arm while never stopping the chest compressions. 17 minutes had passed. The electrical spikes on the monitor were becoming slightly more regular. Amy could see that Jake's color was improving just a tiny bit. His lips were less blue than before. I need to tell you about human blood too, Amy said to the fascinated aliens. We have something called hemoglobin that carries oxygen very efficiently. But we also have myoglobin in our muscle tissue that stores extra oxygen. Zixta looked confused. Your species stores backup oxygen in muscles? This seems very inefficient from an engineering perspective. It's not for efficiency, Amy explained. It's for survival. When a human holds their breath or their heart stops beating, the muscles release their stored oxygen. This gives the brain a few extra minutes to survive. Dr. Kethvar was taking detailed notes. This explains how your captain might still have viable brain tissue. But surely there must be some damage by now. Amy checked Jake's pupils with a small flashlight. They were still fixed and dilated, which was not a good sign. But she had seen worse cases recover. Maybe there will be some damage. But human brains are also very good at healing themselves. We call it neuroplasticity. Neuroplasticity? Asked one of the Vorthon medics. Human brain cells can learn new jobs, Amy said. If one part of the brain gets damaged, other parts can sometimes take over its work. We've had people recover from terrible brain injuries and live normal lives. She gave Jake 2 more breaths and then went back to compressions. Also, human children's brains are especially good at this. Jake is only 32 years old, so his brain still has some of that healing ability. The aliens were learning things about human biology that amazed them. Their own species had evolved on worlds that were more stable and predictable. They had never needed such extreme survival mechanisms. Amy reached for the defibrillator again. I want to try a different setting this time. Sometimes a weaker shock works better than a strong one. She adjusted the controls and placed the paddles on Jake's chest. Clear, she called out and delivered the shock. This time the response was different. The monitor showed a series of spikes that looked almost like a normal heartbeat for about 3 seconds before going back to irregular blips. Did you see that? Amy asked excitedly. His heart remembered how to beat normally for a moment. The sinoatrial node is working. Dr. Kethvar studied the recording of those 3 seconds. It does appear to be a normal cardiac rhythm, but it stopped again. That's okay, Amy said. It means the electrical system in his heart is not completely dead. We just need to help it remember how to work consistently. She prepared another medication. This is called amiodarone. It helps stabilize heart rhythms. She injected it while continuing the chest compressions with one hand. 18 minutes had passed since Jake's heart had stopped. Amy was getting tired, but she refused to slow down. Sweat dripped from her face onto Jake's chest, but she kept working. Human Amy, said one of the Kalari nurses. You have been doing this for so long. Do you need rest? I could try to copy your technique, Amy shook her head. Thank you, but this requires specific training. If you do it wrong, you can break ribs or damage organs. Human medical schools teach this for months before we're allowed to do it on real patients. She looked around at all the alien faces watching her. But I can teach you the theory. Human CPR works because we're manually pumping the blood through the body. Every time I push down on his chest, I'm squeezing his heart to make it pump blood to his brain. Zixta was fascinated by the mechanics. So you are acting as an external heart pump? This is brilliant engineering. Exactly, Amy said. And when I breathe into his lungs, I'm putting oxygen into his blood. Together, these 2 actions keep his brain alive even though his heart has stopped. Dr. Kethvar realized he was witnessing medical techniques that could revolutionize emergency care throughout the galaxy. These methods could save many lives among all species. Why have humans not shared this knowledge before? Amy paused for a moment. Because until now nobody asked. Most alien species we've met assumed their medical knowledge was more advanced than ours. They didn't think humans could teach them anything. She checked Jake's pulse again. Still nothing she could feel, but the monitors were showing more electrical activity. Also, human medicine developed differently because we had to deal with trauma and emergencies. Most other species focus on preventing disease rather than treating severe injuries. The truth was that humans were considered primitive by most galactic civilizations. Their aggressive nature and tendency toward violence made other species avoid learning from them. But now the aliens in the medical bay were seeing that this same aggressive nature made humans incredibly good at fighting death itself. Amy prepared the defibrillator for another attempt. I'm going to try a synchronized shock this time. The machine will wait for the right moment in his heart's electrical cycle before delivering the shock. She set the controls and placed the paddles. The machine waited for several seconds, analyzing Jake's cardiac rhythm before automatically delivering the shock. The result was immediate and dramatic. The monitor suddenly showed a strong, steady heartbeat. Amy quickly felt for Jake's pulse and found it. Weak, but definitely there. We've got him back, she said with tears in her eyes. Jake's pulse was weak but steady. Amy could feel it clearly under her fingers now. The monitor showed a regular heartbeat for the first time in 19 minutes. But she knew this was just the beginning. Getting his heart started was only the first step. His blood pressure is very low, Dr. Kethvar observed as he watched the readings, and his breathing has not returned. Amy was already preparing for the next phase of treatment. That's normal. His heart is like an engine that's been sitting unused for a long time. It needs help getting back to full strength. She drew up another syringe with clear liquid. This is called dopamine, she explained to the watching aliens. It helps make the heart beat stronger and raises blood pressure. She connected the syringe to Jake's IV line and began a slow injection. The Vorthon medics watched in fascination as Jake's blood pressure slowly began to improve. Your human medications work very quickly, one of them observed. Amy nodded while checking Jake's breathing. He was not breathing on his own yet, so she connected him to a ventilator machine. Human emergency medicine is designed to work fast. When someone is dying, you don't have time for slow treatments. She adjusted the ventilator settings carefully. I'm giving him pure oxygen right now to help his blood carry as much as possible to his brain. His lungs were damaged by the blast, so they need extra help. Zixta was recording every detail. How do you know what settings to use for the breathing machine? Training and experience, Amy replied. Every human medical professional learns how to use these machines. We practice on simulators and study hundreds of cases. She monitored Jake's oxygen levels on the screen. Dr. Kethvar was amazed at how many different machines and medications Amy was using. Human medicine appears to be very aggressive compared to our methods. We prefer to let the body heal itself naturally. Amy checked Jake's pupils again with her flashlight. They were still dilated, but she thought she saw a tiny response to the light. Sometimes the body needs help healing itself, especially after severe trauma like Jake experienced. She prepared another medication. This is called mannitol. It reduces swelling in the brain. She injected it slowly while explaining. When the brain doesn't get oxygen for a long time, it can swell up. This swelling can cause more damage than the original injury. 20 minutes had passed since Jake's heart had stopped. His vital signs were stable, but he was still unconscious. Amy knew that the next few hours would be critical for determining if there was permanent brain damage. What happens now? Asked one of the Kalari nurses. Will Captain Morrison wake up soon? Amy adjusted Jake's IV fluids. It might take hours or even days for him to wake up. His brain needs time to recover from the lack of oxygen. We call this therapeutic hypothermia. She pointed to a cooling blanket she was wrapping around Jake's body. I'm keeping his body temperature low for the next 24 hours. This helps protect his brain cells while they heal. The aliens had never seen anything like this before. In their medical traditions, patients either recovered quickly or died. The idea of keeping someone in a controlled state between life and death was completely foreign to them. Dr. Kethvar studied the cooling equipment. So you are intentionally keeping him cold? This seems dangerous. It's actually protective, Amy explained. Remember how the cold helped him survive when his heart stopped? The same principle works during recovery. Cold brain cells need less energy so they can focus on healing instead of normal brain activities. She showed them a special thermometer that measured Jake's core body temperature. I'll keep him at 33 degrees Celsius for exactly 24 hours. Then I'll slowly warm him up and see if he wakes up. Zixta clicked her mandibles thoughtfully. This is like putting a damaged machine into maintenance mode while repairs are made. Very logical from an engineering perspective. Amy smiled at the comparison. That's actually a good way to think about it. We're giving his brain time to run self-diagnostics and repair damaged circuits. She began setting up additional monitoring equipment. I need to watch his brain activity very carefully. These electrodes will show us if his brain is working normally or if there are problems. The EEG machine showed Jake's brainwaves as wavy lines on a screen. Right now they were very slow and irregular, which was expected after such severe oxygen deprivation. What do normal human brainwaves look like? Dr. Kethvar asked. Amy adjusted the machine to show a comparison. Normal awake brainwaves are faster and more organized. During sleep they slow down but in regular patterns. Jake's brain is somewhere between sleep and coma right now. One of the Vorthan medics pointed at the screen. Those patterns look almost like the hibernation brainwaves we see in some species on my homeworld. That's a very good observation, Amy said. Jake's brain has essentially put itself into hibernation mode to conserve energy while it heals. This is another human survival mechanism. She continued explaining while monitoring his vital signs. Some human patients have recovered completely after being in this state for weeks or even months. The brain is very good at protecting itself when it has to. Dr. Kethvar was taking detailed notes about everything Amy was doing. These techniques could potentially help many species. Have there been studies on using human medical methods on aliens? Amy shook her head. Not really. Most alien species we've encountered have their own advanced medical systems. Nobody thought human medicine had anything useful to offer. She checked Jake's heart rhythm again. It was getting stronger and more regular. But trauma medicine might be different. Injuries and emergencies are basically the same for all species. Hearts stop beating. Brains need oxygen. Blood needs to circulate. 25 minutes had passed since the successful resuscitation. Jake's condition was stable, but Amy knew she needed to watch him constantly. Brain swelling could develop suddenly and be fatal if not treated immediately. I need to do a brain scan, she said while preparing portable scanning equipment. This will show us if there's any bleeding or swelling inside his skull. The ultrasound machine showed cross-sections of Jake's brain on a small screen. Amy studied them carefully, looking for signs of damage. What do you see? Dr. Kethvar asked. Good news, Amy replied. No bleeding and only minimal swelling. His brain structure looks normal. She pointed to different areas on the screen. This is his frontal lobe where personality and decision-making happen. This area controls movement. This part handles memory. The aliens were amazed at how much detail the human scanning equipment could show. Your diagnostic technology is very sophisticated, Zixta observed. Amy nodded while continuing the scan. Human medicine has focused heavily on brain and heart problems, because those are our biggest killers. We've developed very advanced ways to study and treat them. She moved the scanner to check Jake's spinal cord. I also need to make sure the blast didn't damage his spine. Spinal injuries can be just as serious as brain injuries. The scan showed that Jake's spine was intact. Amy felt relieved. She had seen too many cases where patients survived cardiac arrest, only to discover they were paralyzed from spinal damage. Everything looks good so far, she reported to the watching aliens. Now we wait and see if his brain can recover function. As if responding to her words, one of Jake's fingers twitched slightly. It was barely noticeable, but Amy saw it immediately. Did you see that? She asked excitedly. He moved his finger. Dr. Kethvar looked closely but saw nothing. Are you certain? I did not observe any movement. Amy watched Jake's hand carefully. After a few seconds, his finger twitched again. This time everyone saw it. Involuntary muscle response, Amy explained. It means his spinal cord is working and his brain is starting to send signals to his muscles. The aliens stared in amazement as Jake's body showed more small signs of returning function. His breathing seemed to be getting slightly stronger even with the ventilator helping him. Amy felt Jake's pulse again. It was definitely getting stronger, and his skin was starting to feel warmer. His circulation is improving. That's exactly what we want to see. She made notes in his medical chart about every small change. In human medicine, detailed records were crucial for tracking patient progress and making treatment decisions. How long before we know if his brain is working normally? Asked one of the Kalari nurses. Amy checked the time display. It could be anywhere from a few hours to several days. Every patient is different, but the signs we're seeing now are very encouraging. She looked around at all the alien medical staff who had been watching her work. Would you like to learn more about human resuscitation techniques? I could teach you the basics. The aliens looked at each other with excitement. They had just witnessed something they had thought was impossible. The idea of learning these techniques was incredibly appealing. Dr. Cathvar spoke for the group. We would be honored to learn from you, Amy. These methods could save many lives throughout the galaxy. The news spread through the surviving fleet like wildfire. Captain Jake Morrison had been dead for 19 minutes and brought back to life by a human nurse. Within hours, every ship in the battle group was requesting details about what had happened. Commander Lisa Park of the destroyer Swift Arrow was the first to contact the Hope's Dawn. Her face appeared on the communication screen looking tired and worried. Amy, is it true? Did you really bring Jake back from the dead? Amy was still monitoring Jake's vital signs, but she took a moment to speak with the commander. He wasn't dead. His heart had stopped, but his brain was still viable. Human medicine has techniques for these situations. Lisa shook her head in amazement. The alien medical officers on my ship are saying it's impossible. They want to know how you did it. Dr. Cathvar stepped into view of the camera. Commander Park, I can confirm what Nurse Carter accomplished. Captain Morrison was without cardiac function for 19 minutes and 12 seconds. By all known medical standards, he should have suffered permanent brain death. The communication channel filled with requests from other ships. Medical officers from dozens of different species wanted to observe Amy's techniques. Some were skeptical. Others were desperate because they had critically wounded crew members who might benefit from human medical intervention. Amy found herself giving impromptu medical lectures over the fleet communication system. She started with the basics of CPR while still monitoring Jake's recovery. The most important thing to understand is that death is a process, not an event, she explained to the gathered alien medical staff on screen. Just because the heart stops beating doesn't mean the person is gone forever. Dr. Relak from the Thakarian medical ship Crystal Hope asked the first question. His crystal-like skin was glowing yellow with curiosity. Nurse Carter, how do you determine if someone can be resuscitated? What are the signs that it's too late? Amy thought for a moment while checking Jake's brain activity monitor. In human medicine, we have a saying. Someone is not dead until they are warm and dead. Cold preserves brain tissue. We've had successful resuscitations after people were underwater in cold water for over an hour. A Kalari medical officer named Dr. Fura spoke, up from the transport ship Mountain Wind. But surely there must be limits. How do you know when to stop trying? That depends on many factors, Amy replied. Age of the patient, how long they were down, what caused the cardiac arrest, whether they have other injuries. She gestured toward Jake. In Captain Morrison's case, he was young and healthy. The ship was cold, which helped preserve his brain. So I kept trying. Dr. Cathvar added his observations. What amazed me most was Nurse Carter's understanding of human physiology. She knew exactly which medications to use and when. This level of emergency medicine training appears to be standard among human medical personnel. Commander Park nodded. All human military medical staff are trained in advanced trauma care. We have to be ready for battlefield injuries and emergency situations. An insectoid medical officer from the engineering vessel Starbuilder clicked excitedly. Could these techniques work on other species? Our biology is different from humans, but the basic principles might apply. Amy had been wondering about that herself. The chest compression technique should work for any species with a central heart. The medications might need to be adjusted for different physiologies. The defibrillation could work if the species uses electrical impulses to control their heart. She demonstrated the hand positioning for chest compressions on a practice dummy while talking. The key is to push hard and fast. You want to compress the chest at least 2 inches deep at a rate of 100 compressions per minute. Dr. Relak was taking detailed notes. What about the breathing assistance? Not all species have the same lung structure as humans. Any species that breathes air could benefit from artificial respiration, Amy explained. You might need to adjust the technique for different mouth or lung shapes, but the principle is the same. You're putting oxygen into their blood. The questions continued for over an hour. Amy found herself explaining concepts that were basic knowledge in human medicine, but completely new to alien doctors. The idea of aggressive intervention to prevent death was revolutionary to most galactic species. Dr. Vex from the Zephyrian battle cruiser Dark Storm was particularly interested in the medications Amy had used. These drugs you injected directly into the heart muscle. This seems very dangerous, Amy smiled. It can be dangerous if you don't know what you're doing. But in emergency medicine, sometimes you have to take calculated risks. If someone is already dead, you can't make them more dead by trying to save them. This philosophy shocked many of the alien medical officers. Their cultures emphasized careful deliberation and avoiding harm above all else. The human approach of accepting risk to save lives was completely foreign to them. Jake's vital signs continued to improve during the medical conference. His heart rhythm was now strong and regular. His blood pressure had returned to normal levels. Most importantly, his brain activity was showing more organized patterns. "Look at this," Amy said while pointing to the EEG monitor. "His brain waves are starting to show normal sleep patterns. That's a very good sign for neurological recovery." Dr. Kethvar studied the display. "How long before he regains consciousness?" "Hard to say," Amy replied. "Could be hours or days. His brain is still in protective mode while it finishes healing." She adjusted the cooling blanket around Jake. "I'll start warming him up gradually tomorrow. That should help stimulate awakening." Commander Park looked concerned. "Is there any chance of permanent damage?" Amy was honest. There's always some risk after prolonged cardiac arrest. He might have memory problems or difficulty with complex thinking. But the signs so far are very encouraging. She explained the concept of neuroplasticity to the assembled medical officers. Human brains can adapt and rewire themselves after injury. Even if some areas are damaged, other parts can sometimes learn to do their jobs. Dr. Furra was amazed. "So human brains can actually repair themselves? This is not possible with most species we know." "It's more common in younger patients," Amy said. "Jake is 32, which gives him a good chance of significant recovery, even if there was some brain damage." The medical conference was interrupted by an emergency call from the battleship Iron Fist. Their captain had been severely injured in the recent battle and was close to death from internal bleeding. "Need human medical assistance immediately," the ship's medical officer reported. "Our techniques cannot save him." Amy looked at Jake's stable condition and made a decision. "I can't leave Captain Morrison right now, but I can walk you through emergency surgery procedures over video link." For the next 3 hours, Amy provided remote medical consultation to alien doctors trying to save their captain. She guided them through techniques for stopping internal bleeding, managing blood pressure, and supporting vital organs. The aliens were amazed at the aggressive surgical procedures humans had developed. Direct heart massage, emergency blood transfusions, artificial life support systems that could keep someone alive even when multiple organs were failing. "Human medicine seems designed for warfare," observed Dr. Rylak. "These techniques are perfect for treating severe trauma. Injuries," Amy nodded while monitoring both Jake and the remote surgery. "Humans have been fighting wars for thousands of years. We've learned how to put people back together after they've been torn apart." The surgery was successful. The alien captain survived thanks to human medical knowledge applied by alien hands under Amy's guidance. Word of this second miracle spread even faster through the fleet. By the end of the day, Amy had consulted on 17 different medical emergencies across the battle group. Species that had never worked together were sharing information and learning from each other. The human techniques were being adapted for alien physiology with remarkable success. Jake's recovery continued steadily. His body temperature was slowly returning to normal, and his brain activity was becoming more organized. Amy felt confident that he would survive, though she still worried about possible cognitive damage. Dr. Kethvar approached her as she finished her latest consultation. "Amy, you have accomplished something remarkable today. Not just saving Captain Morrison, but bringing together the medical knowledge of dozens of species." Amy checked Jake's pupils with her flashlight. This time they responded normally to the light. "I just did what any human medic would do. We don't give up on our patients." "That attitude is exactly what makes human medicine so effective," Dr. Kethvar replied. "Other species accept death as natural and inevitable. Humans fight against it with everything they have." As if responding to their conversation, Jake's eyes fluttered open for just a moment before closing again. "It was brief but unmistakable. Did you see that?" Amy asked excitedly. Dr. Kethvar nodded with amazement. "Captain Morrison is truly returning to us. This is beyond anything I thought possible." Amy squeezed Jake's hand gently. Welcome back, Captain. You gave us quite a scare. The Kalari homeworld of Nexus Prime was under siege when Amy's team arrived. The planet's main hospital was overwhelmed with wounded. Soldiers and civilians. Dr. Fura met them at the landing pad with exhaustion written across her furry features. Lieutenant, Commander Carter, thank you for coming, she said while leading them through corridors filled with wounded beings. We are losing so many that could be saved. Our traditional healing methods are not sufficient for these war injuries. Amy surveyed the medical facility with professional eyes. It was clean and well organized, but the techniques being used were far different from human emergency medicine. Wounded beings lay quietly on beds waiting for their bodies to heal naturally or slowly succumb to their injuries. Dr. Fura, show me your most critical cases, Amy requested. They entered a ward where the most severely injured patients were housed. Amy immediately spotted several beings who would have been saved easily in any human hospital, but were considered hopeless here. A young Kalari soldier had massive internal bleeding from shrapnel wounds. His vital signs were weak but stable. In human medicine, he would have been in surgery within minutes of arrival. Why isn't he being operated on? Amy asked. Dr. Fura looked confused. Surgery is very dangerous. We prefer to let the body heal itself naturally. If we cut him open, we might make his injuries worse. Amy shook her head. Dr. Fura, he's going to die from blood loss if you don't stop the internal bleeding. His body can't heal itself if all his blood leaks into his abdomen. She quickly explained the concept of emergency surgery to stabilize critical patients. The goal isn't to heal everything perfectly. It's to stop the immediate threats to life so the body has time to heal. Dr. Kethavar arrived with a group of reptilian medics who had traveled from their own war zones. Amy, we have brought surgical equipment adapted for multiple species. Where do we begin? Amy organized her team quickly. Mike, you take the Kalari medics and focus on trauma surgery basics. Janet, you work with the Vorthans on cardiac resuscitation. Steve, you teach the Thakarians about emergency medications. The training began immediately with hands-on demonstration, using actual patients who were dying despite alien medical care. Amy worked alongside Dr. Fura to save the young soldier with internal bleeding. First, we need to get him to surgery immediately, Amy explained while rushing the patient to the operating room. Every minute he bleeds internally reduces his chances of survival. She showed the Kalari surgical team how to quickly open the abdomen and locate sources of bleeding. Look for dark blood pooling in the abdominal cavity. That tells you where the injury is. The alien surgeons were amazed at how aggressively humans approached surgery. They were used to careful, deliberate procedures that took hours. Amy's techniques were fast and focused on immediate life-saving interventions. You are cutting and moving so quickly, Dr. Fura observed nervously. Are you not worried about damaging healthy organs? I'm more worried about him dying on the table, Amy replied while suturing a torn blood vessel. We can fix minor surgical damage later. We can't fix death. Within 2 hours, they had stopped the internal bleeding and stabilized the soldier's condition. His vital signs improved dramatically once the blood loss was controlled. The Kalari medical staff watched in amazement as their patient went from dying to stable in a single surgery. Word spread quickly through the hospital about the miraculous human techniques. Meanwhile, Mike Chen was teaching emergency surgery to a group of Vorthan medics. Their patients had different anatomy, but the basic principles were the same. Vorthans have 3 primary circulation centers, he explained while operating on a wounded pilot. You need to check all 3 for bleeding rather than just looking for one heart like humans have. The Vorthan medics were quick learners. Their natural precision and attention to detail made them excellent surgeons once they learned to work faster and more aggressively. Janet Rodriguez was having remarkable success teaching cardiac resuscitation to Thakarian medics. Their crystalline physiology actually made them ideal candidates for electrical defibrillation therapy. Your people's crystal-based biology conducts electricity very efficiently, she explained while demonstrating on a patient who had gone into cardiac arrest. The defibrillation works even better on Thakarians than on humans. The patient's crystal skin glowed brightly as the electrical shock restarted his heart. The Thakarian medics were amazed to see one of their own people brought back from clinical death. The end of the first week, Amy's team had trained over 300 alien medics in basic human trauma techniques. The mortality rate in the hospital dropped from 60% to 30% almost immediately. Dr. Fura was amazed at the transformation. Lieutenant Commander Carter, your methods have saved more lives in 1 week than we saved in the previous month. How is this possible? Amy was exhausted but exhilarated by the results. The key is aggressive early intervention. Don't wait for the body to heal itself. Help it heal by removing immediate threats to life. News of the success on Nexus Prime spread throughout the Alliance. Military commanders who had been skeptical of human medical knowledge now demanded training for their own medics. Amy received urgent requests from dozens of worlds. The Zephyrian front needed trauma specialists. The Outer Rim colonies required emergency surgery training. Even the core worlds wanted to learn human resuscitation techniques. We need to expand the program, Amy told her team during a planning meeting. There are thousands of medics who need this training and we only have 12 instructors. Dr. Kethvar proposed a solution. What if we train the trainers? Teach selected alien medics to instruct others in human techniques. That would multiply our effectiveness. Amy liked the idea immediately. We'll create a certification program. Alien medics who master human techniques can become instructors themselves and spread the knowledge even faster. They selected the most capable students from each species to become master trainers. Dr. Fura was chosen to lead Kalari medical training. A Vorthan surgeon named Dr. Zilk became the primary instructor for his people. The Thakarian crystal healer Dr. Prex took charge of training in the core systems. Within a month, there were human-trained alien instructors operating on 50 different worlds. The techniques spread exponentially as each new instructor trained dozens more medics. The impact on the war was dramatic. Alliance casualty rates dropped to levels the military had never seen before. Soldiers who would have died from their wounds now survived to fight again. Civilian casualties from bombing raids decreased significantly as emergency responders learned life-saving techniques. Amy received reports from across the galaxy about successful resuscitations and emergency surgeries. A Kalari fighter pilot brought back after 8 minutes of cardiac arrest. A Vorthan civilian saved from severe blast trauma through aggressive surgery. A Thakarian child rescued from drowning using human CPR techniques. The psychological impact was as important as the medical benefits. Alliance soldiers fought with renewed courage, knowing that human-trained medics could save them from injuries that had previously been fatal. Zephyrian intelligence reports began, mentioning the human death-defying medics as a significant factor in Alliance morale. Enemy commanders complained that Alliance forces were becoming reckless because they no longer feared battlefield injuries. Amy was promoted to commander and given charge of all Alliance medical training programs. She established training centers on key worlds throughout Alliance space and created standardized curricula for teaching human techniques to different species. The program continued to expand. Advanced trauma surgery for complex injuries, emergency medications adapted for alien physiology, portable life support systems that could keep critically wounded beings alive during transport to hospitals. Dr. Kethvar became her second in command and helped coordinate training across species boundaries. Amy, what you have accomplished here is remarkable. Human medical knowledge has become the foundation of Alliance healthcare. Amy felt proud of what they had achieved, but also overwhelmed by the ongoing demand. There's still so much more we could teach them. Advanced cardiac procedures, neurosurgery techniques, organ transplantation methods, one step at a time, Dr. Kethvar advised. You have already revolutionized emergency medicine throughout the galaxy. The lives saved by your training program number in the tens of thousands. The war was turning in the Alliance's favor, partly due to the medical revolution Amy had started. Fewer dead soldiers meant more experienced fighters. Fewer casualties meant higher morale. Better medical care meant planets were more willing to join the Alliance cause. 6 months after arriving on Nexus Prime, Amy received a message that made her smile. Captain Jake Morrison had made a complete recovery and was returning to active duty. His ship Hope's Dawn had been repaired and was ready for medical missions again. Amy, I hear you've been busy while I was recovering. Jake's message said, the whole galaxy is talking about the human nurse who taught aliens how to bring people back from the dead. I'm proud of you. The Kalari homeworld of Nexus Prime was under siege when Amy's team arrived. The planet's main hospital was overwhelmed with wounded soldiers and civilians. Dr. Fura met them at the landing pad with exhaustion written across her furry features. Lieutenant Commander Carter, thank you for coming, she said while leading them through corridors filled with wounded beings. We are losing so many that could be saved. Our traditional healing methods are not sufficient for these war injuries. Amy surveyed the medical facility with professional eyes. It was clean and well organized, but the techniques being used were far different from human emergency medicine. Wounded beings lay quietly on beds waiting for their bodies to heal naturally or slowly succumb to their injuries. Dr. Furra, show me your most critical cases, Amy requested. They entered a ward where the most severely injured patients were housed. Amy immediately spotted several beings who would have been saved easily in any human hospital, but were considered hopeless here. A young Kalari soldier had massive internal bleeding from shrapnel wounds. His vital signs were weak but stable. In human medicine, he would have been in surgery within minutes of arrival. Why isn't he being operated on? Amy asked. Dr. Furra looked confused. Surgery is very dangerous. We prefer to let the body heal itself naturally. If we cut him open, we might make his injuries worse. Amy shook her head. Dr. Furra, he's going to die from blood loss if you don't stop the internal bleeding. His body can't heal itself if all his blood leaks into his abdomen. She quickly explained the concept of emergency surgery to stabilize critical patients. The goal isn't to heal everything perfectly. It's to stop the immediate threats to life, so the body has time to heal. Dr. Kethvar arrived with a group of reptilian medics who had traveled from their own war zones. Amy, we have brought surgical equipment adapted for multiple species. Where do we begin? Amy organized her team quickly. Mike, you take the Kalari medics and focus on trauma surgery basics. Janet, you work with the Vorthans on cardiac resuscitation. Steve, you teach the Thakarians about emergency medications. The training began immediately with hands-on demonstration using actual patients who were dying despite alien medical care. Amy worked alongside Dr. Furra to save the young soldier with internal bleeding. First, we need to get him to surgery immediately, Amy explained while rushing the patient to the operating room. Every minute he bleeds internally reduces his chances of survival. She showed the Kalari surgical team how to quickly open the abdomen and locate sources of bleeding. Look for dark blood pooling in the abdominal cavity. That tells you where the injury is. The alien surgeons were amazed at how aggressively humans approached surgery. They were used to careful, deliberate procedures that took hours. Amy's techniques were fast and focused on immediate life-saving interventions. You are cutting and moving so quickly, Dr. Furra observed nervously. Are you not worried about damaging healthy organs? I'm more worried about him dying on the table, Amy replied, while suturing a torn blood vessel. We can fix minor surgical damage later. We can't fix death. Within 2 hours, they had stopped the internal bleeding and stabilized the soldier's condition. His vital signs improved dramatically once the blood loss was controlled. The Kalari medical staff watched in amazement as their patient went from dying to stable in a single surgery. Word spread quickly through the hospital about the miraculous human techniques. Meanwhile, Mike Chen was teaching emergency surgery to a group of Vorthan medics. Their patients had different anatomy, but the basic principles were the same. Vorthans have 3 primary circulation centers, he explained while operating on a wounded pilot. You need to check all 3 for bleeding rather than just looking for one heart like humans have. The Vorthan medics were quick learners. Their natural precision and attention to detail made them excellent surgeons once they learned to work faster and more aggressively. Janet Rodriguez was having remarkable success teaching cardiac resuscitation to Thakarian medics. Their crystalline physiology actually made them ideal candidates for electrical defibrillation therapy. Your people's crystal-based biology conducts electricity very efficiently, she explained while demonstrating on a patient who had gone into cardiac arrest. The defibrillation works even better on Thakarians than on humans. The patient's crystal skin glowed brightly as the electrical shock restarted his heart. The Thakarian medics were amazed to see one of their own people brought back from clinical death. By the end of the first week, Amy's team had trained over 300 alien medics in basic human trauma techniques. The mortality rate in the hospital dropped from 60% to 30% almost immediately. Dr. Furra was amazed at the transformation. Lieutenant Commander Carter, your methods have saved more lives in 1 week than we saved in the previous month. How is this possible? Amy was exhausted, but exhilarated by the results. The key is aggressive early intervention. Don't wait for the body to heal itself. Help it heal by removing immediate threats to life. News of the success on Nexus Prime spread throughout the Alliance. Military commanders who had been skeptical of human medical knowledge now demanded training for their own medics. Amy received urgent requests from dozens of worlds. The Zephyrian front needed trauma specialists. The Outer Rim colonies required emergency surgery training. Even the core worlds wanted to learn human resuscitation techniques. We need to expand the program, Amy told her team during a planning meeting. There are thousands of medics who need this training and we only have 12 instructors. Dr. Kethvar proposed a solution. What if we train the trainers, teach selected alien medics to instruct others in human techniques? That would multiply our effectiveness. Amy liked the idea immediately. We'll create a certification program. Alien medics who master human techniques can become instructors themselves and spread the knowledge even faster. They selected the most capable students from each species to become master trainers. Dr. Fura was chosen to lead Kalari medical training. A Vorthon surgeon named Dr. Zilk became the primary instructor for his people. The Thakarian crystal healer Dr. Prex took charge of training in the core systems. Within a month, there were human-trained, alien instructors operating on 50 different worlds. The techniques spread exponentially as each new instructor trained dozens more medics. The impact on the war was dramatic. Alliance casualty rates dropped to levels the military had never seen before. Soldiers who would have died from their wounds now survived to fight again. Civilian casualties from bombing raids decreased significantly as emergency responders learned life-saving techniques. Amy received reports from across the galaxy about successful resuscitations and emergency surgeries. A Kalari fighter pilot brought back after 8 minutes of cardiac arrest. A Vorthon civilian saved from severe blast trauma through aggressive surgery. A Thakarian child rescued from drowning using human CPR techniques. The psychological impact was as important as the medical benefits. Alliance soldiers fought with renewed courage knowing that human-trained medics could save them from injuries that had previously been fatal. Zephyrian intelligence reports began mentioning the human death-defying medics as a significant factor in Alliance morale. Enemy commanders complained that Alliance forces were becoming reckless because they no longer feared battlefield injuries. Amy was promoted to commander and given charge of all Alliance medical training programs. She established training centers on key worlds throughout Alliance space and created standardized curricula for teaching human techniques to different species. The program continued to expand. Advanced trauma surgery for complex injuries, emergency medications adapted for alien physiology, portable life support systems that could keep critically wounded beings alive during transport to hospitals. Dr. Kethvar became her second in command and helped coordinate training across species boundaries. Amy, what you have accomplished here is remarkable. Human medical knowledge has become the foundation of Alliance healthcare. Amy felt proud of what they had achieved but also overwhelmed by the ongoing demand. There's still so much more we could teach them. Advanced cardiac procedures, neurosurgery techniques, organ transplantation methods. One step at a time, Dr. Kethvar advised. You have already revolutionized emergency medicine throughout the galaxy. The lives saved by your training program number in the tens of thousands. The war was turning in the Alliance's favor, partly due to the medical revolution Amy had started. Fewer dead soldiers meant more experienced fighters. Fewer casualties meant higher morale. Better medical care meant planets were more willing to join the Alliance cause. 6 months after arriving on Nexus Prime, Amy received a message that made her smile. Captain Jake Morrison had made a complete recovery and was returning to active duty. His ship Hope's Dawn had been repaired and was ready for medical missions again. Amy, I hear you've been busy while I was recovering, Jake's message said. The whole galaxy is talking about the human nurse who taught aliens how to bring people back from the dead. I'm proud of you. Amy looked out at the training facility she had built where hundreds of alien medics were learning to save lives using human techniques. It had all started with her refusal to give up on one dying captain. 1 year after the medical revolution began, Commander Amy Carter stood before the largest gathering of medical professionals in galactic history. The Grand Assembly Hall on the neutral world of Concordia was filled with beings from over 200 different species. The Galactic Medical Council had called this historic meeting to formally recognize the impact of human medical techniques on Alliance healthcare. Representatives from every major medical institution in known space had traveled here to honor the human nurse who had changed everything. Amy felt nervous as she looked out at the massive crowd. Kalori doctors with their furry faces and bright eyes, reptilian physicians with scales that changed color with emotion, crystalline Thacarian healers whose bodies sparkled under the lights, insectoid medics with compound eyes and delicate limbs. All of them had learned techniques that started with her refusing to give up on Captain Jake Morrison. Dr. Kethvar approached the podium first to introduce Amy. His reptilian features showed obvious pride as he spoke to the assembly. Fellow medical professionals, we gather today to honor someone who taught us that death does not have to be final. 1 year ago, most species in this room believed that cardiac arrest meant certain brain death within minutes. We accepted this as biological law. The crowd murmured in agreement. Until recently, the medical knowledge of most galactic species had remained unchanged for centuries. Death was treated as inevitable once certain conditions were met. But human Commander Amy Carter showed us that our understanding was incomplete. Dr. Kethavar continued. She demonstrated techniques that seemed impossible by our standards, bringing beings back to life after their hearts had stopped beating. For 20 minutes or more, Amy remembered that first desperate resuscitation attempt aboard the Hope's Dawn. She had been just a nurse trying to save her captain using techniques every human medic knew. She never imagined it would lead to this moment. The statistics speak for themselves, Dr. Kethvar announced. In the past year, Alliance medical facilities have reported a 75% reduction in preventable deaths. Over 2 million beings are alive today who would have died under our previous medical protocols. The audience erupted in appreciative sounds from dozens of different species. Kalari chittering, fourth-hand musical tones, Thacarian crystal chimes. The overwhelming response made Amy feel the weight of what had been accomplished. Captain Jake Morrison entered the hall wearing his dress uniform with a broad smile on his face. His recovery had been complete with no lasting effects from his 19 minutes of cardiac arrest. He had become living proof that human medical techniques could achieve the impossible. It is my honor to present Commander Amy Carter with the Galactic Medal of Medical Excellence, Jake announced as he approached the podium. This is the highest honor our medical council can bestow, and has never before been given to a member of a single species for techniques benefiting all species. Amy stepped forward to accept the medal. It was a beautiful piece of crystalline artwork that captured light and reflected it in brilliant patterns. She felt overwhelmed by the significance of the moment. "Thank you," she said simply, "but this medal belongs to everyone who was willing to learn new techniques and question old assumptions. Medical knowledge only saves lives when it's shared freely between all beings." The crowd responded with another wave of appreciative sounds. Amy had become not just a medical pioneer but a symbol of cooperation between species that had previously remained isolated in their own medical traditions. Dr. Zilk, the Vorthan surgeon, stood to address the assembly. "Commander Carter, I speak for all Vorthan medics when I say your training saved my entire medical corps. Before learning human techniques, we were losing 60% of our wounded soldiers. Now our survival rate is over 90%. Similar testimonials came from medical officers representing dozens of different species. The impact had been universal despite the vast differences in alien physiology. Dr. Prex, the Thacarian healer, spoke next. "Human emergency medicine has been adapted successfully for crystalline physiology. Our people now survive injuries that would have been fatal just 1 year ago. The defibrillation techniques work even better on Thacarians than on humans due to our natural electrical conductivity." Amy felt amazed at how quickly the techniques had spread and been modified for different species. What had started as basic human CPR and trauma surgery had evolved into a comprehensive galactic emergency medical system. The ceremony continued with presentations about specific medical breakthroughs that had resulted from human-alien medical cooperation, new medications that combined human pharmaceuticals with alien biochemistry, surgical techniques that merged human aggressiveness with alien precision, diagnostic equipment that incorporated human understanding of trauma with alien technological sophistication. Admiral Sarah Torres appeared via holographic transmission to address the assembly. Commander Carter, your medical training program has been as important to our war effort as any weapon or strategy. Alliance forces now fight with confidence, knowing that human-trained medics can save them from injuries that were previously fatal. The war against the Zephyrian Empire had indeed turned in the Alliance's favor. Better medical care meant higher survival rates, which translated into more experienced soldiers and higher morale throughout Alliance forces. Amy was asked to speak about the future of galactic medicine. She stood at the podium looking out at hundreds of faces representing the greatest medical minds in known space. When I was fighting to save Captain Morrison's life, I was just doing what any human medic would do. We don't give up easily. We fight death with everything we have. She paused to gather her thoughts. But what I learned from all of you is that every species has unique medical knowledge worth sharing. Kalari healing herbs that work better than human painkillers. Fourth-hand surgical precision that surpasses human techniques. Thakarian diagnostic abilities that can detect diseases humans would miss. She gestured toward the diverse crowd. The real breakthrough wasn't teaching human medicine to aliens. It was realizing that medical knowledge belongs to everyone. When we share freely across species boundaries, we all become better healers. The assembly responded with the loudest appreciation sounds Amy had heard all day. The message of cooperative medical advancement resonated with everyone present. Dr. Kethvar returned to the podium for closing remarks. Commander Carter has given us more than new medical techniques. She has shown us a new way of thinking about medicine itself, not as separate traditions for different species, but as shared knowledge for saving all life. The formal ceremony concluded with the announcement of the Amy Carter Institute for Galactic Emergency Medicine. The institute would be established on Concordia with branch campuses throughout Alliance space to continue teaching human-inspired medical techniques to new generations of alien healers. Amy felt honored, but also slightly overwhelmed by having an entire medical institute named after her. I hope future students will remember that medical knowledge advances when different perspectives work together, she said. As the crowd began to disperse, Amy was approached by young medical students from dozens of species. They wanted to learn directly from the legendary human nurse who had taught the galaxy that death was not always final. A young Kalari medical student named Dr. Kiva asked the question many were thinking. Commander Carter, what advice do you have for medics who want to follow your example? Amy thought for a moment. Never give up on a patient who might still be saved. Question medical assumptions when you encounter something that doesn't fit established knowledge. And remember that every being's life has value worth fighting for. Captain Jake Morrison joined Amy as the assembly hall emptied. Amy, look what you started with, one stubborn refusal to accept my death. Now there are human-trained medics working in hospitals throughout the galaxy. Amy smiled as she thought about the journey from that desperate resuscitation attempt to this moment. Jake, when I was doing CPR on you for those 19 minutes, I never imagined it would lead to anything like this. That's what made it work, Jake replied. You weren't thinking about making history or changing galactic medicine. You were just trying to save one person's life. That's what real medicine is about. Amy looked around the great hall where portraits of famous galactic medical pioneers lined the walls. Someday her picture would hang there too, representing the human who taught aliens that death could be defeated through knowledge, determination, and cooperation. But she knew the real victory wasn't the medal or the institute or even the millions of lives saved. The real victory was that beings throughout the galaxy now refused to give up on each other when medical emergencies occurred. The stubborn human determination that had driven her to keep working on Jake's lifeless body had become a galactic medical philosophy. Never accept death when life might still be possible. Fight for every patient with everything available. Share knowledge freely so all beings benefit. As Amy left Concordia to return to her training duties, she carried with her the satisfaction of knowing that her refusal to give up on one dying captain had changed the course of galactic medicine forever. The legendary human nurse who taught aliens how to bring people back from the dead had become a symbol of hope throughout the galaxy.